Looking at the bill that came out of the House, billionaire investor Warren Buffett said that your plan would reduce his tax bill by $680,000. And he has a question for public officials that I wanted to pose to you. Let's listen.
I think it would be very interesting for the constituents of every congressman that voted for that bill to ask a question, just one question. Are you above 250 on your adjusted gross income? And if you were, how much would you have saved from what you paid last year from this bill you just passed?
So what's the answer? How much would you save under the House and Senate bills?
Well, remember that Obamacare taxes were put in place to build a whole new government program, government-run health care. When you back out of that, when you make it so that you've got a patient-centered system where patients and families and doctors are running health care and not the federal government, then that of necessity allows you to do so with not as much money. And so we believe it's absolutely vital that we decrease taxes for the American people, allow them to keep more of their hard-earned money. Dana, did you appreciate, and I don't know if your listeners do, there's 6.5 million Americans right now who are paying $3 billion in penalties, in taxes, just for the privilege of not purchasing health coverage. Can you imagine that? That's a system that isn't working for those 6.5 million. How about lowering the taxes for those 6.5 million?
And I understand that, but the question now is, when it comes to the bill that is before the United States Senate, the fact of the matter is people like you are going to get a tax cut.
Well, the fact of the matter is that those 6.5 million will no longer have to pay $3 billion in a penalty or a tax to the federal government because they're not interested in purchasing what the government wants to force them to buy. Look, this is a system right now that is run by the government, for the government, dictated by the government, and it's not responding to patients' needs. And that's what we want to get to. 28 million individuals right now uninsured, 6.5 million folks spending $3 billion in a tax penalty, premiums up, deductibles up, coverage going away. We haven't even begun to talk about the states where they're going to have counties that have no insurance issuer next year. That's not a system that works for patients. That's what we're trying to fix.
I'm not sure Warren Buffett is going to be satisfied that he got an answer to his question, but I appreciate it.
Well, I'm not sure Warren Buffett is interested. I'm not sure Warren Buffett is interested in covering those individuals in those counties that won't have insurance. What are we going to do about that? That's the key. We've got to make certain that we're looking at every single American citizen and every single individual across this land who needs coverage that they want for themselves and for their family, not that the government forces them to buy.